Your enamel can heal itself at the early white spot stage, before a hole forms. The chalky white spots near the gum line, the spots a dentist often watches but doesn't yet fill, can rebuild. The crystals that grow back are more acid-resistant than the original enamel. There's a 90-day protocol, 3 ingredients. Most dentists focus on what's already past the rebuild window, because by the time you're in the chair, the damage usually is. The early stage window is something only you can act on. Here is the science behind the claim. The 2008 paper from John Featherstone in the Australian Dental Journal is the canonical reference. Tooth decay isn't a one-way slide. It's a daily tug of war. Every time you eat sugar or starch, the bacteria on your teeth dump acid for about 30 minutes. The acid pulls calcium and phosphate out of your enamel. That's demineralization. Between meals, your saliva delivers fresh calcium and phosphate back to the surface. That's remineralization. As long as the rebuild wins more days than the breakdown, your teeth get stronger. When the breakdown wins, you get a white spot, then a soft brown spot, then a hole, then a filling. The window of reversal sits between the white spot and the hole. That stage is called a non-cavitated lesion. Featherstone's group and every cariology textbook since have shown that those non-cavitated lesions can fully remineralize if you load the surface with the right minerals. Once the surface collapses into a cavity with a visible hole, the rebuild is over. That part is restorative dentistry. The window you can actually act on is the early stage. Here's the toothpaste that does the work. 2 options, both proven. The first is fluoride. The 2019 Cochrane review pooled 96 trials, 85,000 kids and adults. The pattern was clean. Fluoride toothpaste at 1,000 parts per million or higher reduced new cavities significantly compared to placebo. The higher the concentration, the bigger the protective effect. Featherstone's mechanism work shows the new crystal that grows back with fluoride is more acid-resistant than the original enamel. That's the part the dental industry has been right about for 50 years. The second option is newer, hydroxyapatite, the same calcium phosphate mineral your enamel is already made of. A 2019 trial out of BDJ Open ran a head-to-head against fluoride. 30 adults, 14 days. The hydroxyapatite paste produced over 50% remineralization of artificial white spot lesions. Fluoride did the same. There was no statistical difference between them. A 2024 meta-analysis pooled together 18 studies, pooling the cleanest 5 randomized trials plus 8 in situ trials. The hydroxyapatite paste matches fluoride for non-cavitated lesion remineralization in adults, with the upside that it's considered safe if swallowed, which matters for kids who swallow toothpaste. If you have fluoride sensitivity or kids who swallow toothpaste, hydroxyapatite is a legitimate alternative. If you're a high cavity risk adult, fluoride still has the largest and longest data set. Both work. Pick one. The toothpaste alone isn't the whole protocol. The frequency of what you eat matters more than the toothpaste does. That's the part most people get backwards.
Snacking is the silent enemy of your enamel. The 2018 review in Trends in Microbiology laid out the mechanism cleanly. Every time you eat anything fermentable, the pH on your tooth surface crashes for about 30 minutes. That's 1 acid window. 3 meals a day equals 3 windows. 6 snacks and a coffee with sugar equals 7 windows. Same total sugar, twice the damage. The teeth never get a chance to rebuild between exposures. So here is the 90-day protocol. 5 moves. The first move is the toothpaste, fluoride or hydroxyapatite, twice a day. Spit, don't rinse. Most people brush, then immediately wash the protective film off with water. Let the paste sit on your teeth. The minerals need contact time to migrate into the enamel. The second move is to compress your eating window. If you eat 3 meals, eat 3 meals. Stop the constant grazing. Stop the all-day sipping of coffee with cream and sugar. Stop the after-dinner snacks. The dental literature is clear. Frequency of sugar exposure beats total sugar quantity. 5 sodas in one sitting hurts less than 5 sodas spread across the day. The third move is xylitol gum after meals. The 2015 Cochrane review on xylitol is honest. The evidence is moderate, but the mechanism is real. Xylitol starves the Streptococcus mutans bacteria that drive cavity formation. Chewing gum stimulates saliva flow, which delivers calcium and phosphate back to the surface. 2 to 3 pieces of xylitol gum a day, chewed for 10 minutes after meals, is a low-cost lever with low risk. Just check the label. It needs to say xylitol as the first sweetener, not sorbitol or aspartame. The fourth move is what you brush with and how you floss. The 2014 Cochrane review on powered toothbrushes pulled together 56 trials and 5,000 people. Powered, especially the oscillating rotating kind, beat manual on both plaque and gum inflammation. Then add floss or a water flosser. The water flosser isn't better than string floss for plaque, but it's significantly better at reducing gum bleeding. Use whichever one you'll actually do daily. Done badly is worse than done with the easier tool. The fifth move is the one that connects your teeth to your heart. The 2020 consensus report from the European Federation of Periodontics and the World Heart Federation laid it out. Periodontitis, untreated gum disease, sits as one of the strongest epidemiological predictors of future cardiovascular events. The 2007 New England Journal of Medicine paper showed that intensive treatment of gum disease measurably improved blood vessel function within 6 months. Your mouth is the upstream factor for your heart you keep ignoring. 90 days of this, and the white spot stage of damage starts walking backward. The bleeding gums stop. Your dentist sees the difference on the next cleaning. The cavities that already have a hole still need a filling. No protocol changes that. See your dentist. But the early stage damage, the kind you can still feel as a slight roughness with your tongue, that's the stuff you can rebuild from your bathroom. This is research, not medical advice. Talk to your dentist before making any change. If this hit, check out our video on the mouthwash habit that's silently raising your blood pressure. The link is in the description below.